Memorize the 12 cranial nerves. Future nurse, cranial nerves, 12 of them. And NCLEX loves asking which one you'd assess after a stroke, or which one is damaged when a patient can't smile on one side. Let's lock these in your brain in 6 minutes. In this lesson, we'll learn the names of all 12 nerves, determine if they are sensory or motor, and master the assessment findings for the most tested nerves on the NCLEX. First, the names. The classic mnemonic every nursing student uses, OOO to touch and feel very good velvet. Ah, heaven. Let's go. Olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, hypoglossal. 1 through 12, say it with me. OOO to touch and feel very good velvet. Ah, heaven. Now you've got the order. Now, sensory, motor, or both. Second mnemonic. Some say marry money, but my brother says big brains matter more. S equals sensory, M equals motor, B equals both. CN1, sensory. CN2, sensory. CN3, motor. CN4, motor. CN5, both. CN6, motor. CN7, both. CN8, sensory. CN9, both. CN10, both. CN11, motor. CN12, motor. Some say marry money, but my brother says big brains matter more. Now, which ones actually show up on NCLEX? 5 heavy hitters. CN2, optic. How do you test it? Snellen chart, visual fields, damage equals vision loss. CN3, oculomotor. It controls pupil constriction and most eye movement. PERRLA. That's testing CN3. A dilated fixed pupil after a head injury, CN3 compression. This is an emergency. Call the provider now. CN5, trigeminal. Sensory to the face, motor to chewing. Trigeminal neuralgia, excruciating facial pain. How do you test it? Light touch to forehead, cheeks, and jaw. Have the patient clench their teeth. CN7, facial. Motor to facial muscles, sensory for taste. Bell's palsy, CN7. Patient can't smile, can't close their eye on the affected side. Stroke also affects CN7. But with stroke, the forehead is usually spared. Bell's palsy affects the whole side. That's a classic NCLEX distinction. CN10, vagus, the wanderer. It innervates the throat, heart, lungs, and GI tract. Gag reflex, CN9 and 10. Hoarseness after thyroid surgery could be vagus nerve damage. NCLEX-style question. A patient with a stroke has difficulty swallowing and a weak gag reflex. Which cranial nerves should the nurse assess? Answer: CN9 and CN10. Swallowing and gag, that's 9 and 10. Another one, the nurse asks a patient to shrug their shoulders against resistance. Which cranial nerve is being tested? CN11, accessory. Shrugging equals accessory. One more. A patient cannot stick their tongue out straight. It deviates to the right. CN12, hypoglossal. Quick recap. Names: OOO to touch and feel very good velvet. Ah, heaven. Sensory, motor, both. Some say marry money. Heavy hitters: optic, oculomotor, trigeminal, facial, vagus. Tongue deviation equals 12, shoulder shrug equals 11, gag reflex equals 9 and 10. You've got this. And when cranial nerves show up on your exam, you're going to smile because you know them. You're building clinical judgment every single day. Cranial nerves are part of my A&P Part 1 course. Study guides, quizzes, and a practice exam. Link in the description. I got this. Now let's see you ace those cranial nerves. Next up, we dive deeper into brain anatomy and function. See you there.